This part of the video on implant protective occlusion deals with the location of occlusal contact on an implant in maximum intercuspation and the contact patterns during excursive movements on implant crowns. When an implant is placed along the long axis of the occlusion load in a proper position perpendicular to the occlusal plane or the curve of Wilson and the curve of Spee, then the contact during maximum intercuspation on this implant's crown should fall on the center of the implant. The contact should be on a flat surface that is perpendicular to the long axis of the implant. This can be done by identifying the center of a properly angulated implant, creating a 2 to 3 mm wide central fossa that is flat and perpendicular to the long axis of the implant and parallel to the curve of Wilson and Spee. Occlude the opposing cusp directly over this flat central fossa perpendicular to the occlusal plane. Understand that ideally an implant crown should have primary contact over its center along its long axis only. Its buccal cusp in the mandibular or palatal cusp in the maxillary arch are not functional cusp contacts as against natural dentition. So if you have a mandibular implant facing a maxillary natural tooth, then the maxillary palatal cusp should land over the center of the implant in the mandibular arch. And that should be the only contact that the mandibular crown should have over an implant. The buccal cusp of the mandibular crown, the lingual cusps of the mandibular crown, and the marginal ridges all should ideally be out of contact from the opposing natural tooth. Likewise, if you have a maxillary implant facing a mandibular natural tooth, then the mandibular buccal cusps of the natural teeth should fall over the center of the maxillary implant along its long axis. The maxillary implant crown should have no palatal cusp contacts or no marginal ridge contacts or no buccal cusp contacts. Now, if a mandibular implant faces a maxillary implant, then ideally the contacts over both the crowns should be directed along their long axis respectively and should fall on the center of each implant. But that is rarely possible. In this scenario, we should favor the weaker arch. The primary contact should be over the center of the maxillary implant. In most of such cases, the mandibular implant crown's buccal cusp will fall over the center of the maxillary implant. When implants are splinted together, the primary contact has to be over the center of each implants and the secondary contacts can be in the zone between the implants as shown in the photo. The implant crowns should have an overall smaller occlusal table when not in aesthetic zone. A smaller occlusal table requires lesser force to accomplish the task of mastication as compared to a wider occlusal table. A wider occlusal table also acts as a horizontal cantilever, amplifying forces on the implant and bone system. During excursions, there should be no contacts on the posterior crowns over implants. A canine implant and its crown can take lateral excursive load during lateral excursions, and anterior implant crowns can take protrusive loads during protrusion. The anteriors on implants should disocclude the posteriors on implants or posteriors that are natural teeth. If there are natural teeth present in the anterior region, they should assist the canine or the anterior implants to share the load during excursions in a pattern that the natural teeth should guide first and the implants should come next due to the periodontal ligament cushion that the natural teeth have and the lateral mobility that the natural teeth have. Stay tuned for the next video where I will explain the contact pattern when you are doing full mouth reconstructions on implants in both the arches, when you have a full implant supported arch against full natural dentition, and when you have a full implant supported arch against a denture. By the way, do not pass by without hitting the like button and subscribing to my channel for more such videos. It encourages me to put this vast knowledge on open platforms. Hope this helps.